of the things is that, we're not doing snake oil sales here. We cannot bring back the vision of a 20-year-old that had perfect vision, no glasses. That's something that only God can do. But we can get you very close to improving your vision, and we'll go over any specific limitations that any technology would have for your specific eye. But we can really get a lot of freedom from glasses for our patients so that they're not having to wear glasses for any activity. And that's really amazing, and it's life-changing for so many of our patients. So depending on what type of lens and what else is going on in your eyes, we'll talk about some of the unique side effects that you would have. So the one that comes up the most if you're talking to your friends and things about cataract surgery is with the multifocal lens implant. There is more glare and halos around lights versus just a single focus lens, the standard or basic lens. And that's because it's trying to bend light so that you can see and focus at multiple distances. So there is a little bit of sharing of the light that's going on, but 90% of our patients after 6 months don't even notice the glare because they're so happy not to have to wear glasses and really can tolerate that glare. And majority also say that glare is less than what they were experiencing before surgery. About 30% of patients after cataract surgery or refractive lens exchange will develop something called it's kind of like a scar behind the lens implant called a PCO. And that can cloud their vision a little bit and make them feel like a cataract's coming back or the vision is kind of deteriorating. But fortunately, that's something that isn't common, not everybody's getting it. And is treatable with a laser that we perform in clinic that doesn't hurt, takes less than 5 minutes to do, and is covered by insurance. So we always evaluate everybody after the surgery to kind of look for if they're developing a PCO or if they're starting to get one. We'll kind of mention it and things to look out for. With cataract surgery or refractive lens exchange, we are not treating the floaters. The floaters are coming from the back part of your eye. And when we're doing surgery in the front part of the eye, we don't want to be anywhere near the back part of the eye. But some patients, especially initially after the cataract surgery, will feel like their floaters are more noticeable. And they're more noticeable because we've cleared up the vision. Their cloudy lens isn't there. The refractive error, the prescription they had isn't there. But again, if you're not focusing on it, your brain hates seeing floaters. So the brain is really learning to cancel it out. It's kind of like looking through a dirty windshield. At first, you notice all the spots, but when you're focusing on the road, you're not looking at any of the spots. You can just see fine, and it's only when you force yourself to focus on the spots that you'll see them.